I've had people ask before, what got you interested in that area of failed back surgery? And, to be honest with you, I don't know that I found it as much as it probably found me. The Like many back surgeons, I'd see people that had a surgery, another surgery, and so forth, and it hadn't gone well, and it's devastating. It's not just devastating to the person who had surgery, but it's devastating to the spouses and the children and the family. When I first started, kind of get out of my training, I saw plenty of people that had surgery back then too that didn't do well. And the way I was trained, the way most people were, is you do the best you can as a surgeon. Sometimes you win, sometimes you don't. Almost like kind of cutting the cards to see who gets the highest card and who gets the lowest card. Along the way, things such as some people don't want to get better, or some people just like those narcotics or pills. Some folks don't like to work that much. Some people are a little emotional, a little, they're just not a good candidate for surgery. It was always the patient's fault. Somehow, some way, it was never the surgeon's fault. And yeah, I believed that at first. And bit by bit, my career has been one of new technology. Thankfully, it's so far become mainstream every time. But as I would try new approaches to these problems, I found gradually what would work and what I really wanted to improve on. And over time, it became pretty apparent to me, and I think my data, which I'm happy to share, shows that most of the time these problems that folks come into me for have an answer, and it may not be a perfect answer, but it can be a really good answer. It can be a good issue with patients who have failed back surgery. I'll ask it's most of them. So the other physicians who've treated you, what did they think was wrong? I mean, what was their analysis? And generally what I hear are, your x-rays look good. I don't know. And that's probably an honest answer. They might say scar tissue, gotcha. Or, well, you sure do seem to like a lot of pain medicine and other medicines, don't you? Yeah, maybe you ought to see a psychiatrist, maybe they can help you. And ultimately, it's, why don't you just go to pain management? Pain management has always bothered me a little bit. I go, thank goodness for some cases pain management is around, but just the very name of it is you're being managed, you're being controlled, your life's never your own. You never graduate from pain management. There's no out. I mean, how many people does anyone know? They showed up to pain management, they start getting shot after shot and blocks and stimulators and morphine pumps and so forth, that one day say, well, you're all taken care of. Your life is back now. We don't need to manage you anymore. It's just not much different than going to high school and you never, ever, ever graduate. And even at that point, your surgeon, he must have done a great job for you. Who knows why you're hurting, but we'll just keep poking and prodding and giving you medication. Now, if you're the patient and you've gone through this sort of thing, and I'll just pick it, say the husband, but it could be the wife too. You've worked a good part of your career. Everything's fine. Your back gives trouble for whatever reason. It could be an injury, it could just happen. You see somebody that you trust, they've got good credentials, you wind up with surgery, it doesn't fix the problem, perhaps you're worse. Sometimes you'll have a second, third, fourth, whatever surgeries. And at the end of it, what are you going to say when that person who worked on you, you put your trust in them, says, everything looks good, sometimes it just doesn't work out. There's a lot of different surgeries that we do now. We work on people's eyes, and we do gallbladder surgery, hip replacement, and on and on. There's so many surgeries we do, and not a single one of them has a Honecker failed back syndrome. Not one. We have failed whatever we do back surgery syndrome because it's fairly common. And although it used to make sense to me, you have to understand as a surgeon, I'll do the best I can. If it doesn't work, I could say, sorry, just see pain management and bring the next person in. That's not right for the patient. The patients are the ones who lose out on that. So now you're that husband that I was just sort of suggesting. Here's the wife sitting next to him, and she's thinking, gee, I thought I made a great choice when we got married. He seemed to work. He felt good. He would smile every day. He would help out. And now he's just miserable and can't do anything. And the doctors tell us, or at least they suggest to us, it's his problem in big part. And if he just sort of snap to and get on with it, he might just do fine. The kids pick that up too. It just destroys the family dynamics. And this isn't something that's talked about very much. Pain management seems to be like this panacea, but I'm not sure that it really is at all. You're managed the rest of your life always with the subtle and sometimes not subtle message that it's a failure. There's something in you that's a failure. That may be true occasionally, but not often. A little over half the people I see for the first time have had surgery done elsewhere. And bit by bit, as I mentioned, bit by bit, I started to take these things seriously with a different thought process. It's not your fault. It's not your fault. And not to throw shade on any other surgeon, I don't do that. But I'll try to look at these things with fresh eyes. And often there are reasons for the failures. And if I can figure things out such as that and address them, and I've got somebody who wants to get better, which most people come to see me, they really want to get better, we tend to do quite well. We can make chicken salad out of a lot of really unfortunate things. I used to believe, for instance, that the more surgeries you had, the harder it is to get better. But that's not what I'm finding in my sort of data collection and experience. What I find is you can have one surgery that's failed, you can have 10 surgeries that failed. But if I can figure out the reason that these failures occurred, it is something that's addressable and can be fixed, you can turn your life around. And it's stunning. I remember the first few cases that I got involved with, and it wasn't just that the outcome was really good, but you watch somebody get their life back. They get off the narcotics, and that haze that surrounds them when you talk to them disappears. They become more normal. The wife or husband notices that. The kids notice that. And I remember so long ago, I had a child tell me as a teenager, wow, I've got my mom back, and this is mom. And they remembered and grew up not really having somebody who was very functional as their mother. And it was really quite dramatic to see that they could at least finally pick up where they had left off over a decade ago. It's amazing to me how many people have and suffer through what really is often a treatable problem without even recognizing it. For my part, it's pretty humble humbling. For my part, it's pretty humbling. But also, I worry a little bit because I know that every person I see that's had surgery before that hasn't worked out and their life is not good, they put their trust in somebody before me and it didn't work out. So I'm pretty careful to say, if I can help you, I want to be really sure of it before I open my mouth, because I don't want to be the next guy in line to disappoint somebody. It's gut-wrenching to see that sort of thing. The patients who have failed back surgery are not all, they're not just concerned. People who have failed back surgery aren't just considered hopeless by a lot of folks. But if you take somebody like myself who is trying to specialize in this particular niche, you know, the surgeon that came before me is going to say, you don't need any more surgery. He's already told you that. So if I do something, they're going to say what I do isn't needed. You don't need none of that stuff. That's not necessary. So I let my patients speak for myself, because what I do is I get involved in situations that are sometimes considered hopeless, only based on my experience in the data that I have. If you go in and just Google failed back surgery syndrome, you'll get two things. One, you'll get definitions of it, which is, I think, pretty much everybody can guess. You had back surgery and it didn't work out. The other is, what do you do about it? And there are lots and lots of sites. I've looked at these things. They're virtually every one is a pain center. That's not a cure. That's not a way to really fix the problem. It's a way to manage you for the rest of your life until you die. And I don't see that that's a great way to live. In fact, you're not really living. You're existing. You're surviving. But you're not really experiencing the quality of life by doing that. So this is a new niche of medicine, and it's something, because I've had just so many cases that have turned out well. I thought, this is what I want to focus on. I mean, all of us, I think, or many of us at least, want to give back to this world something. And this is what I think I can give back, is to focus on this as exclusively as I can. You know, most physicians don't care to deal with this directly anyway. I've had many meetings with pain management physicians and neurologists and so forth, trying to make sure I can interact and do as much of a team approach as possible and realistic. But the goal is, at the end of it, a significant pain decrease and an increase in functionality. And we've been real successful in doing that. You know, there are things that we can address. I feel like there are things I can address often quite well, and there are things I can't fix. I'll give you some examples of things that I can't fix. You've had previous surgery, and the previous surgeon has cut a nerve. I can't fix that. If the surgeons before me have, in the course of doing the surgery, have pretty well killed the back muscles, it doesn't happen often, but it can happen, then I can't fix that. Most other things we can fix. And I guess a little piece of it is, if you've had failed back surgery and more or less you've stumped your previous doctor, or you frankly even frustrated him because, you know, his result wasn't as good as either of you thought it was going to be, and it's just easier to wind up in pain management. We offer fresh eyes, and I find this is a really special group of people. It's not just that the quality of life is so devastated in this, but folks really are interested in they like answers. And even if it's something that I don't think I can help out, I will take every patient in and talk to them personally. So it's not like my nurse practitioner or physician assistant, because I have neither of them with my practice. It's a personal visit with me. And on top of that,
Sorry, it's a personal business.
so anyway, when a patient comes to see me, what at least what I've been told is the experience is a little different. You're not going to be seeing a nurse practitioner or a physician assistant. You know, your life is already likely in a bad quality of state. I think it's important that you meet me and spend time one-on-one. We'll get to know each other pretty well, quite frankly. I'll show you your x-rays. In fact, I'll give you a copy of them. And we'll look at what other studies there are. Could it be an MRI, a CAT scan, and so forth? Because what I do is really just common sense. It's not complicated. You don't have to be a college graduate or a PhD to understand why and what I propose to do. And the results of it are good when you do that. So beforehand, you know, if you choose to visit, I hope when you leave, I'll have a very good game plan, whether it's nothing or whether it's, an option to take another swipe at this, so to speak. But if we do, it's going to be thought out and specific for it. And with me, it's time tested. I can't find another practice, at least Googling, and I don't know of another practice anywhere that really tries to focus on these problems. These are extraordinarily complicated sometimes. There's a lot of facets and moving parts to them. But this is what I feel like I can give back at this stage of my career. The most rewarding part of what I do is when it's all said and done and somebody comes in and they're off their narcotics, or their spinal cord stimulator is finally gone, or their morphine pump is gone. They're more active. They can take a camping trip. They can get to the mall without a cane, walker, wheelchair, or that sort of thing. It's a real emotional time when people come back to see me. And I can't think of any other job in the world that I can touch somebody's life, and they touch my life too. It's just amazing, and that's really what keeps me going through, anything else, is that sort of reward. Somebody comes and says, "Dr. McCord, thank you, I'm doing much better. And I want to be careful so I don't mess this up." And most of the time, my answer is, the reason I choose to do things the way I do is you likely can't mess it up. What I don't care for you to do is go through the rest of your days being careful. Look at normal people. Normal people don't think about their back. If I'm able to get somebody back in that situation, I may not give you any limitations. My standard, my typical is this. If someone undergoes surgery, say for their back, particularly failed back problems, we'll get them fixed as well as we can. When you go home from the hospital, a fairly standard thing might be that first weekend when you're home. It's okay to just hang around. I got it. You had surgery. I don't mind taking it too easy for a day or two, but about a week after surgery, it's time to start going. So that means getting out of the house every single day. What I don't want someone doing is sitting around watching mindless TV and looking at the walls. That's not going to help you. If I've got your back fixed, I understand the soreness of surgery, the initial soreness. It's okay. Get out and walk. And you can twist a little. There's nothing wrong with that. You can bend some too. You can make meals, at least light meals. So it's get out of the house. I don't care if you go to the store, the shopping mall, go to the church or the track, but get out, go to a park. 6 weeks, that's one of the markers we put in the ground. This is one that I will tell virtually everybody. There's 3 things. Number 1, you need to walk 2 miles a day by 6 weeks. Now, you don't have to do it at once, but I am really pretty clear on that. It's 2 miles a day. And almost everybody can do that. Number 2, touch your ankles with your knees straight. In other words, I don't want you stiff and feeling good. You should be flexible. You bend at your hips, not at your back, so you should be able to bend. Number 3, and there's virtually no exceptions with this one with me, I'll jump you up and down on this floor, and I'll do it with you. And the floor's pretty hard. I want you to jam your back. That's 6 weeks after surgery. Generally speaking, you can't make your back hurt. And I think almost everybody doubts me. I'll tell you beforehand and sort of prepare you that 6 weeks from now, this is what we're going to do. Almost nobody ever believes me, but I can promise you, virtually everybody does it. And it's a way I can judge how stable I've got things. 12 weeks, that's 3 months after surgery. I rarely get people limitations. At that point, most of the time there's enough healing there that I'm not sure you can really mess it up too much. So get active. You're supposed to. That's why, you go through all this stuff. I've had, I think, 5 people over 30 years that have broken their back after the surgery I did. All of them were car accidents, and they were pretty high-speed accidents. Nobody ever broke their back where I fixed it. It's been up or somewhere else. But thankfully not where I worked on it. Is it indestructible? Probably not, but I haven't had anybody succeed yet at doing that. So these sort of things over years and even a couple of decades with my experience has gradually changed me to, when I see somebody's head, tail, back surgery, kind of, oh, I'm not sure about this, to now, I warmly encourage and embrace, if you'd like another evaluation or opinion, please consider coming. I'd be delighted to look at it and see if there is any other option. A number of patients tell me not only does their former surgeon say there's just nothing that can be done. Sometimes that happens. They have pain management physicians. Generally speaking, they seem like a pretty nice lot, and they've got all sorts of shots and pills and procedures they can keep doing with you. They're not back surgeons. They do not understand, as well as they try. They have little insight on what is fixable or what's not. So here's their world as best I can tell, and I've talked to so many of them now. So somebody has back surgery, the results are not good, so they say, would you mind seeing this patient for me? Just turn it off for him. Come on.
Okay.
Come on in.
You look a little cramped right in there.
Yeah.
I guess that's okay.
Okay.
So I'll ask patients who've been in pain management, how did you get here? And almost always they say, we heard about you from somebody else that you fixed that was in pain management. Rarely does the pain management physician ever think to refer a patient. And it's not that they're wrong or bad people, but they have no training and therefore no insight in what's fixable and what's not. All they know is the person who sent them there, the former surgeon who failed, says everything's as good as it can possibly be. How would they possibly argue with that surgeon? In fact, if they did, he's probably just going to send his patients elsewhere. The patient's the one who gets lost in this whole thing. It's not always, it seems to me, in their absolute best interest in this system. So part of my purpose in talking about failed back surgery in this unique niche is you can think for yourself. And if you choose to get out of the pain cycle and being managed all your life, you have that option. And I would love to work with your pain physician, but you do not need his permission to see me, nor do you need your other surgeon, which it didn't work out's permission either. So that's one of the reasons I'm putting together this website, specifically to say there are options and you may not be told about them. You may not know. I have a lot of patients I know don't. My practice has thrived on word of mouth for a very long time. I see folks from all over the country. It's just how it naturally evolved, and it's all based on good results. So my thought now is if I can put this word out, because I'm really pretty busy, I'd like to encourage other physicians over time to interact. You know, let's talk together. Let's learn, because there are people like this all over this country, really all over the world, that through no fault of their own, their lives are just miserable.